When people get sick, there are real consequences to that. So if this city had paid sick time, we could see lots of benefits on so many levels.
We found that because so many workers can't earn paid sick days, it results in 50,000 trips to the emergency room that are preventable. This results in big costs to the taxpayers and to the city. Altogether, it costs $39.5 million because of these unnecessary emergency department visits, because people can't take a day off to get routine preventive medical care that would keep them healthier and keep them out of the emergency room.
Every day in our ERs, we see the unintended consequences caused by denying workers paid sick days for themselves and their loved ones. Just the other day, I treated a 4-year-old girl who was rushed to the ER for a serious asthma attack. She needed several breathing treatments, steroids, and was ultimately admitted to the intensive care unit, and might have stopped breathing if she had waited any longer. I later consoled her tearful mother, who was unable to skip work, for a routine pediatrician's visit a month earlier, a simple intervention that could have potentially prevented her devastating asthma attack. Earlier this year, I treated a bartender with a fracture in his hand. He pleaded with me not to provide him with the proper treatment, a large, bulky plaster splint, because he wouldn't be allowed to work with it on. He opted instead for a soft, removable splint that almost guaranteed his hand would not heal properly and placed him at risk for lifelong arthritis. I've seen countless restaurant workers who try to work through severe viral illnesses because they need the money. In doing so, they expose their coworkers and customers to dangerous, contagious illnesses and often end up in the ER for fatigue and dehydration.
One of the reasons that's a big barrier for people getting timely primary care is that they can't get the time off from work.
It's simply not a choice that New Yorkers should have to make, but for the vast majority of low-wage workers who do not have paid sick days, it is a reality.
So I want to say it's public health, it's a good budget decision, and it's great for workers and for all New Yorkers. Thank you very much.